Well, we're going to start with project number 5, the lingualized occlusion. I've sent my occlusion rims to the practitioner. They came back. I've mounted my models in centric relation. I can see the keying here. I've taken the silicone pieces out. They've given me a midline, canine line, high lip line, low lip line. I can see they use this gauge here to move the mandible 4 millimeters in advance to give me a protrusive bite record. Although they did not take a protrusive bite record, they said please use average value mountings. So I've set my semi-adjustable articulator to 30-degree condylar guidance. And therefore, using the Bennett shift formula, the average of the condyles would be 30 divided by 8 plus 12, which would be very close to 15 of a Bennett shift here at the top. I've mounted the models without a face bow. I used a jig, and the models are within Bonwell's triangle. This hole here in this Hanno articulator would be 110 millimeters. If I took a ruler, I could measure intercondylar distance as 110, and then up to here is 110, and that's pretty much where I have my lower anterior centrals are going to go. So I'm going to start by setting up the anterior 6 teeth. I've chosen a mold. The practitioner should choose the mold, but these days it seems like they don't have time or not well adverse to choose the mold. So I chose a mold of Vita's R47, where the neck is just a little above the high lip line. Now this is my labial contour. Here's my lower contour. I must have the ridge lines marked on my model, the extent of the anterior ridge labially marked here on my model, so I don't overextend the anterior teeth off the ridge line, creating some instability of my denture. Now it looks like a class 1 occlusion according to the rims here with about a 2 millimeter overjet. I'm going to try to achieve group function, so I'm going to minimize my overbite to a couple of millimeters at most. And I will start now by setting up the anterior teeth. I'll remove this pin, which you should not, but I'll remove this pin so for video purposes you'll be able to see a little bit better. I have my occlusion rims, which were really well done at the clinical stage, and this is my vertical stop right here. Occlusion rims that are not touching vertically, I'm really suspect to see if the correct vertical dimension was established. Now I'm going to carry this midline up here on my model and down on the lower model. I've got my anterior ridge line. I was a little bit cavalier putting that line on. Let me just scrape this off my model and mark 1 lower midline, which will probably be using the teeth to match the upper midline. So I'm going to give you a different angle maybe. I can use my knife here. I'm going to set up just the anterior 6 to start. Now there's a lot of denture philosophies on the denture setup, but I think most of them are pretty standard, that we will use the aesthetic control base to set up my teeth. I would start with my anterior 1/6. My models are soaked in water so that my denture base does not, the wax base doesn't adhere to the model, so it comes apart easily. So I'm just going to seal it down a little bit so it doesn't move during my setup. And then I will start with my anterior 1/6. So I know I have no base plate there, so that's really helping me maintain the length of my prosthetic tooth. I'm going to maintain the midline here, soften the wax. I think we spend more time altering the wax in a denture setup than actually setting up the denture teeth. It seems like the wax manipulation seems to be what takes most of the time. I'm going to heat this up here. Now, if the dentist did not contour my occlusion rim appropriately, then I would use the land area as a rule of thumb for the labial extent of my centrals. In this situation, it seems pretty straightforward that it's almost the same as my rim. You can see here, if I just try to hold steady, that the labial contour of my central is that of my rim. If I turn from the angle, I don't have lingual version. Sorry about that. I don't have lingual version of my anterior teeth as such like you would see in a class 2 div 2. I don't have proclination like this of my denture teeth. I have that anterior slope of that 10 degrees we talked about in our occlusion rim would be the correct emergence angle of the central. Now, naturally, there is different denture setup philosophies where we're going to try to do something vigorous, something more masculine, something more feminine, something for the right-handed individual, the left-handed individual, if they're right or left-face dominant. But I think for this setup here, we'll just try to make it as straightforward and symmetrical as possible. When we're trying to do a group function, achieve group function, that's what denture setup, teeth denture looks very denture because we don't have much overbite as we would in the natural dentition of 80, 90, 95% overbite in the aged individual. The overbite is minimum, 1-2 millimeters, obviously depending on the overjet, condylar guidance, degree to the teeth, but I think on an average, 1 to 2 millimeters overjet. As you can see here, I've put the central and lateral. Before I go and do the canine, I think it'd be prudent to go back and do the other central so I don't lose my midline, but I'm pretty confident of where it is. You can choose to do the other central, but I want to keep this labial contour that I can adjust slightly if my midline's off. Pretty close. I can match it up with the bottom one. So I don't have to redo all anterior 6 setup. I can move that over just a little bit. Line up the midline. This is my plane of occlusion. On the lower, I've got my 2 millimeters. If I put a line there of 2 millimeters overbite. Now, a lot of you may use a setup jig to set up your anterior 6. I find it kind of cumbersome and in the way. So I'm just going to use my rim as my occlusal plane reference point. So when I'm looking at the dentures label here and I open up the bite, I can see that my plane of occlusion is very clear from my lower mandibular rim. The lateral is generally slightly off the plane of occlusion. I may drop the lateral if it's a 0 degree monodegree setup to make contact in the anterior section, but this is going to be a lingualized setup, or we're going to try to make a lingualized setup, utilize a lingualized occlusion, which I think would be from Dr. Hildebrand's original mortar and pestle formus function denture philosophy, which was just a minor departure from Dr. Gysi's original denture philosophy of the 20-degree setup. Dr. Gysi came over to North America and started Dentsply True Bite division, and I think those teeth and that denture setup is very familiar. That philosophy. The lateral, central straight up and down, lateral slightly laid off. This is a personal preference. The neck of the canine is out, having more lingual inclination at the tip. The tip would be the plane of occlusion. I can change the cusp tip of the canine at a later date, as these are very youthful looking. Denture teeth are used for many situations, partial dentures, full dentures, diagnostic dentures. If this is a little bit too youthful, well, then we may put some attrition into our canine. So once I'm satisfied with my anterior 6 setup, I'm going to move on to the lower 6, but I'm not finished yet. Let me just double check my midline. Control of the wax really is helpful. I've always got to keep in mind that I will be the one that will be waxing and festooning the denture for try-ins, so I best not get any excessive wax on the occlusal surfaces or the incisal surfaces, kind of lessening the time consumption of my job. I'm going to soften the wax here, make sure that the wax is very molten, pliable, that it doesn't control the setup of my denture tooth. I'll put the other central in here, double check my midline. the length plane of occlusion. Once I'm satisfied roughly where its location is, I can add some molten wax, sealing it into the denture base on the buccal side and lingual side, or labial and lingual side. Soften the rest of the wax. If I've got too much wax, I can take some of the bulk off with my knife in advance. I'm always keeping in mind the festooning is coming, so there's no sense thinking about it later. Let's think about it now. I can kind of wax up a little bit around the necks, creating an emergence angle. Thinking of my next steps, minimizing my time, trying to work efficiently. But going back, like I said, most denture philosophies, I think they would really be consistent in starting with the anterior 6 teeth. This dictates the aesthetic zone, the vertical dimension, the smile line. And this seems to be our starting point. Even denture teeth, and when we're choosing the teeth, we would choose the 1/6 anterior, correspond to the 1/6 lower, assuming it's a class 1. If it's a class 2, we could maybe go and do a slightly larger anterior 6 mold. And then we got to think about posterior occlusion once we've got the anterior straightened out. Are we going to be doing a 0-degree setup? Will it be crossbite unilateral or bilateral crossbite? Is it a class 3? Is it a class 2? Are we doing a standard class 1 setup? I see most mistakes in the denture departments is that we're really trying to stretch everything into a class 1 20-degree setup, as been propagated by Dr. Gysi at TrueBite, which is really well known. But when we're doing denture setups these days, I see we've got Dr. Hildebrand followed by following Dr. Gysi, minor additions from Dr. Jude, Dr. Haller, Dr. Ulig, Dr. Scheinemacher, lastly Dr. Gerber, the Gerber technique, which is adopted by Candelar, which is also propagating lingualized occlusion, the best posterior denture occlusion, or at least more predictable for the client. We kind of really try to shy away from using words like best, but each one propagating to be slightly more favorable than the other. But I find these days we're incorporating from Dr. Scheinemacher's post-dams, compensating for the shrinkage of acrylic, trying to decrease this percentage of deformation, to Dr. Gerber's lingualized occlusion in the advent of implant retained dentures, overdentures, all trying to do the same thing though. The whole goal is to increase denture stability. So when this patient goes into excursive movements, protrusive, left, and right lateral, that we are trying to minimize the movement or eccentric contacts, which would create or denture instability. So here I have a standard 1/6 setup, and we can go back and maybe pull the neck of this out, decrease this one down, lift this up. I mean, small fine tuning. We could go with our handpiece and try to age these canines if we wish, but we would leave that at the future point of the setup. I'm going to add a little more wax, and I'm looking labially, I'm looking cross-section, looking occlusally, looking for symmetry. Even though these denture teeth do have some asymmetry to them, I don't need to increase any asymmetry unless I really choose to with a vigorous setup. Ideally, these days, I find that patients really shy away from having something more natural looking that maybe we would think would be age appropriate, shade-wise and aesthetic-wise, and they want to go for something that would be more standard and predictable. And I'm using my thumb to simulate the lip, so when I open up the client gently, I can see that I'm have the same amount of freeway space from the occlusal plane. This canine seems to be a little bit lower. And then what I might do is I just might take this off and just slowly take off a little bit of incisal edge of the 1-3 and the 2-3, very slightly. That's going to alleviate any kind of eccentric contacts there. Plus, it's going to look a little more age appropriate. I've just basically taken the tip off the canine. You can choose not to do so. I have a tendency to do so many times over. All right, we'll continue with the lower 6.